Let's talk about the etiology of multiple myeloma. There is no one single thing that we can point out that it can cause or lead to multiple myeloma. In a lot of patients, there have been some certain types of chromosomal mutations that have been found to be the precursor to the multiple myeloma. So we can talk about certain types of trigger points or certain things that have led to multiple myeloma in a few patients. Multiple myeloma has been found is majorly a disease of the elderly. 60 to 70 years of age is the one which generally presents. And it has been found that an exposure to certain radiation, especially in World War II, there were a group of people who were exposed to the nuclear radiation, and 20 years down the line, most of them developed multiple myeloma. So it has been postulated that radiation is one of the common precursors. Someone who's working in a nuclear plant, or they are constantly exposed to radiation, so they might be susceptible to the development of multiple myeloma in the latter part of their life. Similarly, someone who are exposed to the pesticide poisoning, like the farmers or the workers who work in the leather factories, which are exposed to the chemicals of the leather, they have also been postulated to develop multiple myeloma with a greater incidence as compared to a normal population. But all of them are basically postulated hypotheses, and we don't have a confirmed data to confirm a specific association or a causal effect. Uh, Multiple myeloma is a disease which can be triggered by any of the following basically events. Any type of chronic inflammation in the body, it can lead to a triggering of this process. Similarly, any kind of a chronic hypersensitivity reaction to any abnormality. In certain patients, it has been found to trigger the cycle leading to the development of multiple myeloma. Viral disease can be a trigger. A viral disease can lead to an immunological problem. Basically, it wakes up your immunological system. So it has led to the development of a lot of disorders over the period of time. So viral disease in certain types of patients, it has been postulated that after a certain viral disease, that later on going onwards, there were some abnormalities in their hematological system, and that led to the development of multiple myeloma. And radiation exposure, as I talked about in the start, it also has also been postulated to be present in the history of people presenting with multiple myeloma, especially the people working in the leather factories or the people working as farmers exposed to the pesticides. But all of these are postulated hypotheses, and we don't have a strong data to confirm their causal effect or their strong association with multiple myeloma.